stores like Walmart, Walgreens, CVS, Kroger's, Myers, they all have programs for patients who are diabetics or hypertension. You can get your strips as low as $9 a box, and it's like 50 strips in each one. So if you know, as long as they match your glucometer that you're using, okay, if your insurance doesn't pay for it, if you know anyone who does not have insurance. Also, what I have on the table is called a prescription discount card. Anyone can use these cards. And if you don't have insurance, you tell your doctor that you want generic medications, and all you have to pay is $4 per prescription. Sometimes it's cheaper than your copay and your insurance if you have insurance. So, you know, if you know anybody, you can sometimes say, I don't want to use my insurance, I just want to use this card, and all you have to pay is $4. They have to give you the generic one. Okay. Since you guys are familiar with diabetes, I'm just going to highlight some of the high points, tell you exactly what diabetes is. Diabetes basically is that you take in a lot of glucose and you're not producing enough insulin to keep it in a lower level. And the normal ranges for diabetes, for your blood sugar, we like your fasting blood sugar, which is before you eat, to be between 70 and 125. That's before you eat. Now, sometimes your doctor says, I want you to take your blood sugar after you eat. So it should always be at least 2 hours after your meal. That gives your body an opportunity to start adjusting the carbohydrates and get your blood sugar, you know, to be reduced. So your blood sugar after your meal should be between 150 and 200. If it's more than that, you need to talk to your doctor, see what range they want your blood sugar in. They may need to adjust your diabetic medicine. If you're on pills or if you're on insulin, your doctor may need to adjust that medication for you. Okay? So if you know somebody who has diabetes and you're out with them, I want you to be able to recognize some of the signs and symptoms when your blood sugar is too high or if it's too low. When your blood sugar is too high, they'll be excessively thirsty. They'll just drink water. Usually it's water or juice. Water is excessively thirsty, excessively hungry, and they go into the bathroom a lot. They have some tremors. They complain of palpitations. Those are some of the classic signs of when your blood sugar is too high. So if you know these things, if you're out with somebody who has it, you can recognize them and intervene. You can tell them, you can ask them, have you taken your medicine today? You know, if they say no, then you probably need to say, well, you know, we need to take your medicine right now, or see if they have the glucometer with them, check their blood sugar to verify what their number is. If it's like 300 or 400, you probably need to tell them to go and see your doctor, or you need to go to the emergency room if they're really having the symptoms. The other side of that is that you have a diabetic whose blood sugar is too low. That's even more dangerous. Your blood sugar is too low, they're sweating a lot, they're dizzy, they get confused. And then you need to ask them, well, have you eaten today? Because sometimes diabetics will take their insulin or take their pills and don't eat. So that's going to automatically drop your blood sugar. So you need to have some hard candy, something that's going to increase their blood sugar right away. Either some orange juice, apple juice, or a peppermint, some type of hard candy. And then follow behind that, you need to have a protein. Because the blood sugar, the candy is going to spike their blood sugar up, and then they might go the other way. They might have the other symptoms. So you need a protein to help stabilize it out. Some milk, cheese and crackers, peanut butter. All those are good sources of protein the person can have if their blood sugar is going high and you're trying to stabilize it out. Okay. Diabetics, they typically have problems with their feet. It's very, very important for diabetics to monitor their feet every single day. Keep them clean, dry, wear white socks. Even an ingrown toenail can turn into something serious. It's because with diabetes, they tend to have poor circulation in the lower extremities. If you don't have blood flow going down there, down your extremities, then you're at increased risk of developing sores on your feet. So it's very, very important that they monitor their feet every day. Look at their toes, make sure they don't have any broken skin. And it's also recommended that diabetes get their toenails trimmed by podiatrists only. They should not trim their own toenails. When I was working in Harper Hospital years ago, I had a patient, he had come to the hospital, he had a tack in the bottom of his foot. You think you would feel that, a tack. I'm looking, I said, did you know you had a tack in the bottom of your foot? He didn't even know he had it. That's how poor his circulation was. He couldn't feel his feet. A lot of diabetics have neuropathy. You'll hear the term neuropathy. That's the poor circulation in their lower extremities. So it's very important that diabetes monitor their feet every day, follow their diet. You know, a lot of us see diet as a very negative term, including me. But, you know, diet is, we're all on a diet. Whether you're on a high-fat diet, diet is just a word. It's the quality of the foods that you eat is what you need to keep in mind. We all need to have a well-balanced diet. We need to have our carbs, we need to have our proteins, and we need to have our fruits every day. And it's the portion sizes that are important for us. So if you're a diabetic, you can have your fruits and your vegetables. That's what we need to, have more on our plates, our vegetables. We have good carbs, we have bad carbs. Now, do we know what carbs are? What are carbs? Carbohydrates. Anybody know? What foods are considered carbohydrates? Rice is a carbohydrate. Potatoes. What else? Bread. Pasta. Other carbs, the good carbs are your vegetables, your broccoli, your cauliflower, your lima beans. Those are all what we call good carbs. Your bad carbs are your potatoes, corn, sweet peas, rice. Those are not considered the best carbs. But you can have some of those. You can have rice every day as long as you have a good carb that goes with a nice vegetable, spinach, greens. All those are good carbs. So you have to learn we have to have color on our plate. And fruits. We like our berries, our strawberries, our blueberries, our blackberries, bananas. All of these fruits you can have. But it's all in moderation.